Well, hello, everybody, and welcome back for another monthly staff town hall. We're so glad to have you here with us today. My name is Hallie Nicholson. I'm the HR Strategic Communication and Engagement Manager, and I'll be your moderator this afternoon. So we've got a great group of panelists on hand to provide some updates about the COVID-19 pandemic and our campus operations and to answer your questions. So today we're going to be answering questions that came in before the event with registration, and we're also going to be answering questions that are coming in live. So feel free to use the Q&A function. We'll be answering questions both on screen and kind of behind the scenes in written answers. So feel free to use that Q&A box to submit additional questions. Due to our time limitations, we won't be able to get to all your questions, but what we are doing is logging all the questions that come in, kind of finding those hot topics and adding them to the Return to Learn website, and you'll find a link to that in the chat. Today, we've got live closed captioning available for our webinar in two ways. First, you can click on the closed caption button at the bottom of your screen and select Show Subtitles. You can also click on the link that will be pasted in the chat momentarily. So with that, let's get started. And I'd now like to introduce Chancellor Pradeep Khosla to share some welcoming remarks. Take it away.
Thank you, Hallie. Good afternoon and welcome everybody. We continue to see promising news on vaccination rates, both in the nation, in the state, in the county, and most especially at UC San Diego. So we continue to see a high volume of traffic at our REMAC vaccination station and our health facilities and mobile clinics. So UC San Diego is administering between 3,000 and 4,000 doses a day, and this is pretty good. It could be better. As of yesterday, 74% of our staff and faculty have completed their first dose of the vaccine, and 67% are fully vaccinated. That means 2 doses plus 2 weeks beyond the second dose. So 67, more than 2/3 are fully vaccinated. As the second doses wrap up in the coming weeks, we are encouraging anyone who has not received their first dose to do so. Right now, there is no appointment required at REMAC. It's completely walk-in, a walk-up basis. But we do want you to know that REMAC station will close on May 31st. REMAC station will close on May 31st, but do not worry. We will then move to our station in Price Center. The difference between these two is the Price Center station will have much lower capacity, and we are just trying to allocate space based on the capacity needs. As most of you know, the CDC has relaxed certain masking guidelines, and the state and county continue to evaluate risk and adjust accordingly. As far as we are concerned on our campus, we are going to follow the state and county guidelines, and we've been sending regular updates. So please be reading the updates to know what the guidelines are. I know many of you are thinking about what happens in terms of returning to work. So starting next month, we will begin to gradually increase the number of staff on campus. And this is to ramp up our operations in order to return to full campus operations by the start of the fall quarter. And you know that we've announced a fall quarter, which is going to be completely in person. And I can assure you that all decisions that we make will be guided by a commitment to health, safety, and equity. So please be assured of that. If you have any questions, feel free to ask. The timing of the returns will be determined by the local managers and by operational needs. Some employees may return to campus sooner than September 1. Some not, but don't be concerned. Your managers should be in touch with you. As far as I'm concerned, I just want to say thank you to everybody. This has been an unbelievable 15 months, and you all have shown amazing resilience, amazing strength, and I'm so looking forward to coming back to campus. Actually, I'm on campus already. I'm so looking forward to campus starting in person. So thank you very much, and back to you, Hallie.
Thank you very much, Pradeep. All right, so next up, I'd like to introduce the host of our town hall today and my colleague, our Acting Chief Human Resources Officer, Terri Winbush.
Thank you, Hallie. Thank you all for joining us today. I recognize that this is a time commitment to join us for this hour and 15 minutes, even if you end up watching the YouTube telecast later. So we appreciate it. I know, and I know our Chancellor alluded to it a moment ago, but we know the rules and the guidance are changing by the minute. If you watch one press conference from one day to the next, it seems like something has shifted, and just know that we are here to support you. And with that being said, let's just get started into the content so that we can at least learn what we need to know for today until it changes tomorrow. Thank you, Hallie.
All right, thank you very much, Terri. So let's get started. So as we usually do, we're going to start with an update kind of about the pandemic in general, the vaccine. So I'd like to welcome Dr. Chip Schooley, Professor of Medicine, to brief us on some COVID and vaccine related updates. So Chip, take it away.
Thanks very much, Hallie. It's great to be back with everybody today and to continue to see conditions improving. Starting at the 35,000 foot level, you can see that in the orange line, the epidemiology of COVID in the US has continued to improve since our peak early this year and at the tail end of 2020. Things in India, where things had been really terrible and still are not good, are beginning to turn around as well, which is great. And I think we're going to see this kind of whack-a-mole, if you will, off and on over the course of the next number of months in other parts of the world as the virus surges and is in control. There's a little bit of an outbreak going on now in Southeast Asia, for example, but as you can see, things are improving in India. You can see also that there is a notation VOC B1.167, that variant of concern B1.167. That's the strain of virus that seems to be driving the epidemic in India. We'll talk in a few more minutes about the importance of these strain variants. Next slide, please. Things here in San Diego are really quite good. If you just look at the middle panel on the upper three graphics, each one of those bars is a single student infected on campus. You can see we've been having one or two students. The dark bars are students living on campus. The light bar students living off campus, infected each week over the course of the last month or so. And so things really are very quiet among our student body. And the cluster of pink bars shows the amount of testing among our employees, and all the zeros along the bottom are the days that we have no positive cases in our employee population here at UC San Diego on the campus. So very quiet on campus, continuing to be extremely safe as has been the case most of the year. Now let's turn to what a variant of concern is, because we hear a lot about it. What these are families of viruses that emerge over time from the parent strain that initially entered the human population about 16 months ago. SARS-CoV-2 is an RNA virus, and RNA viruses have as one of their hallmarks the ability to drift and vary to stay ahead of the immune response so they can remain in the population over time. And variants of concern are those that seem to be either more able to be transmitted to other people, to cause more severe disease, to be less likely to respond to a vaccination or to prior infection, so that reinfection or infection after vaccination is more common, or to be less effective or less effectively treated by the drugs we have, or that might be missed by diagnostic detection techniques. In other words, our nucleic acid tests. The most important two aspects of this are variants that are able to be transmitted more rapidly and those that cause more severe disease. Most of the variation occurs in the spike protein that sits off the viral envelope and binds the virus to the cells. We're kind of looking down on one of these spikes in each of these three strains of virus. The left is the so-called British strain, the first variant we heard much about. And you can see that it has changes in position 501, right at the very tip of the spike. And that's the portion of the virus that binds to the cells that the virus attacks. And it makes the virus attach much more tightly. And so that rather than coming on and falling off and coming on and falling off, it comes on and stays on until it gets in. That makes this virus more able to compete with other viruses in the community. And as I'll show you in a minute, when it comes into an area of the country, it quickly predominates and takes over the virus in those areas. It also grows more rapidly in people and can cause more severe disease, particularly in people who are older and more likely to become ill. In the middle is the so-called South African strain. It also has that 501 mutation, but it has a couple of others, and most importantly, that yellow one that says E484K. This is a part of the virus that is very important for antibodies made by the vaccines that we are giving. to attack. And at this location, this change in this location makes this virus less susceptible to vaccinations. The Brazilian strain is very much like the South African strain. Both of these strains are able to grow more rapidly and are less susceptible to vaccination, to the vaccines we have. Now, this illustrates what I've told you. This is a series of bars starting back at the beginning of the year in January. And you can see that over time, with each successive period of time, that the amount of tan increases. That's the fraction of the so-called British strain that we're seeing in the United States. It's gradually taking over the strains that were here before, the blue strains that you used to see at the top of the graph. And you can see the orange strains, P1, that's the Brazilian strain. And so you can see that these strains that are able to grow more rapidly gradually push the other ones out of the way. Now, we've heard over the recent past about the Indian strain, and the Indian strain is very much like the British strain and the South African strain in terms of the way it behaves. And it has a mutation at that position 484, which is slightly different from the South African and Brazilian strains, but allows the virus to behave the same way. And this virus has become the predominant strain in India and is pushing the other viral strains out of the way. So I know this is confusing. I put together a little summary slide here that compares the B1, the strain we originally had, to the strains that have emerged after that, and that show how they vary in their ability to grow rapidly, replication kinetics, and their ability to vary from immunologically from the parent strains. And what you can see is the British variant grows a bit more rapidly, but it really isn't that different in terms of its ability to be neutralized by the vaccines we use. The South African and Brazilian strains also grow more rapidly, and they are much more different than the British strain from the old strain, and is less susceptible to vaccines that we use. The Indian strain is somewhat in between the British strain and the South African strains in terms of its neutralizability. And the California strain is kind of a watered down version of the Indian strain, just a little bit worse than their parent strain, but still very susceptible to vaccination. Now, what we've had over time is more and more people in the United States vaccinated, as Chancellor Koshla said. And when we look at people who are now over the age of 12, and that's the percent, those are the people who are eligible for vaccination, we've reached about half of them in the US so far, which is really quite good when you understand the size of the population. Most of these people have been vaccinated with the 2 messenger RNA vaccines, the Pfizer and the Moderna vaccines. And these vaccines are the most potent of all of them in terms of being able to take out all the variants extremely well. So if you've had either of those 2 vaccines, you should feel extremely good about about the level of protection against the variants. The Johnson & Johnson vaccine is also very good. It's not quite as good as the mRNA vaccines in terms of protection, but it keeps most people from becoming infected and keeps almost everyone from being sick enough to require medical attention. In San Diego, we're doing extremely well. You can see that we are well above the US population, 64% as opposed to 50% of people vaccinated, the vaccine series being started. UC San Diego is doing even better. If we look at our populations of students, both on campus and our faculty and staff at the hospital and on campus, we are currently running in between 75 and 80% of people coming to campus have been vaccinated, which is terrific. Shows that we have seen a fall off in the number of people being vaccinated each day in the US. And what this reflects, I think, is the fact that we've picked the low-hanging fruit, people who have for whom it's easy to get to vaccine sites and who are able to get to places where vaccination can occur without too much hassle. Now we have to go and make vaccines available to people in harder to reach populations to get the vaccination rate in the US to as high a level as we can, so we can get back to operating the country in the fashion we did prior to the onset of this pandemic, in late 2019. As you heard, the CDC said that they think it's safe for people who are vaccinated to be indoors with each other with masks off. And I think this is really a reflection of the confidence that we have in the efficacy of these vaccines for people whose immune responses are working. There are people whose immune responses don't work so well, people, for example, with lymphoma or transplant recipients, and we need to be careful about them. That's one of the reasons why people who haven't yet been vaccinated should be vaccinated, to protect people whose immune response won't protect them as well. And that's why you will continue to see people wearing masks even after as we push the vaccination level up. But it's really a sign of progress to be where we are at this point in the epidemic. And I think we'll see gradually changing policies in California and elsewhere as more and more people are vaccinated. Let me turn this over back to you, Hallie, and we'll move on.
All right, thanks a bunch, Chip. So next up, I'd like to introduce our next presenter, Dr. Natasha Martin, Associate Professor of Medicine, and Natasha will be sharing some information about modeling, so looking ahead to the fall. So Natasha, take it away.
Hi, everybody. So today I'll be discussing the epidemic modeling work our team has done simulating the campus repopulation in fall 2021. This work generally is part of the data-driven and adaptive decision-making approach we've employed throughout this entire Return to Learn program. And the goal of this particular analysis was to inform contingency planning for the fall using predictive epidemic modeling with plausible worst-case scenarios. So you can see here on the right that the epidemic model we're using was developed by a faculty member here, Ravi Goyal, and published in Clinical Infectious Diseases. This model simulates SARS-CoV-2 transmission among our roughly 60,000 UC San Diego students, both on and off campus, as well as faculty and staff. A key feature of this model is that it simulates transmission on networks, and these networks have been tailored to room level data on residential housing situation at UC San Diego in terms of the different buildings, sizes, and suite configurations. And it was also tailored to the classroom registration data with different classes of varying sizes. And so these classroom and residence networks are fixed over the course of a term, but we simulate additionally a random network of campus connections where transmission can occur due to social interactions or other kind of campus interactions outside of these building and classroom, residential and classroom settings. So what we've done is used this simulation model to assess the impact of increased campus density in the fall. And we're looking at the impact on total campus-related and community-related transmissions over the course of a term. So today I'll show our modeling examining a scenario where we assume a 75% vaccination coverage among both our students and employees in the fall, with the assumption that individuals who are fully vaccinated have an 80% reduced chance of either acquiring and transmitting the virus to others. So we've made a few key improvements to the model that I wanted to mention today. The first was to incorporate the effect of our wastewater monitoring program. As you know, we currently collect wastewater from 126 samplers covering more than 340 residential and non-residential buildings across campus every day. What we've learned this year is that the wastewater is highly sensitive in detecting infected individuals, with our estimates of 74 to 87% of residential cases that we've diagnosed also detected in the wastewater. Our wastewater results are provided on our public daily dashboard, as well as select targeted email notifications. And what we've learned is that our notifications do double the testing rates in buildings with a positive wastewater signal. So the program is highly effective in detecting infections and generating a testing response. So based on all the data we've collected this year, we then simulate this process in our epidemic model to incorporate the added value of this wastewater monitoring program. So the other key improvement that we made was to calibrate the model to the data we collected through winter quarter in terms of where we saw transmission events occurring among our campus populations. What we found shown here is that both among our off-campus students shown in the pie chart on the left and our on-campus students on the pie chart on the right, is that the vast majority, 84 to 88% of infections were likely acquired in the community, with a small fraction, 11 to 12%, potentially acquired due to campus encounters. And among our on-campus students, 5% of infections were likely related to residential transmissions. As you know, we had no classroom or research related transmissions that we know about. And so this information was used to fine tune our model parameters in terms of transmission risk across these settings. And we use that to inform our understanding about what happens as we increase density within these settings in the fall. So here are the results from the modeling. This slide shows the total simulated transmission events over the entire fall 2021 term among our full campus population of about 60,000, with the red bars in this figure showing the total campus-related transmissions over fall term, and the gray bars showing the community-related transmissions. So like we've observed throughout this past year, the model is continuing to predict that the campus is a safer place than the community, with the vast majority of predicted transmission events occurring in the community and not on campus. Looking at the red bars, which are the campus-related transmissions, we can see that the model is predicting fewer than 20 campus-related transmissions over the entire term, so 1 to 2 per week in the fall. Even in the context of increasing campus density, with these scenarios showing the impact of a shift from singles housing and hybrid instruction on the left, all the way to doubles housing and full in-person instruction on the right-hand side, we can see that bringing more students on campus only results in a few more campus-related transmissions in red, about 5 or more over the whole course of the term. But then if you look at the gray bars, you can see it also reduces the number of community-related transmissions as well. And so overall, again, we're expecting that even with this increased density, the campus will remain a safer place than the community, and we can expect very few transmission events related to our campus activities. A reminder that these are plausible worst-case scenarios with vaccination rates even higher than 75%, which is what we've simulated here. Even fewer infections are predicted. And finally, with our scenario of doubles housing and in-person instruction, which we anticipate to be the situation in the fall, we also examined a range of asymptomatic testing and wastewater monitoring scenarios to see the comparative effect of these different scenarios. This slide similarly shows the cumulative campus-related in red and community-related in gray transmission events over the entire term. And if you look at the red bars, you can see that all the monitoring scenarios we examined resulted in very few, less than 20 total campus-related transmissions over the term, with simulations with wastewater monitoring showing that wastewater monitoring is highly effective in detecting infections. Wastewater monitoring is likely to remain a key component of our viral monitoring strategy, in addition to our testing program, both for detecting individual infections, but we can also sequence the virus detected among our individual testing program, as well as our wastewater monitoring program, to assess for the presence of variants of concern and monitor that situation actively throughout the fall. Overall, this modeling work continues to support our data-driven approach to enable the resumption of campus activities while leveraging the effective and adaptive strategies we've developed over the course of this year to keep the campus safe for fall 2021 and beyond. And with that, I'll hand it back to you, Hallie.
All right, thanks a bunch, Natasha. Okay, so now that we've got a pretty good kind of overview of the COVID and the vaccine landscape, let's shift focus a little bit and look at our sort of campus operations. So I'd like to welcome Terri back on screen, and Terri's going to provide us some updates about return to campus. It's all you, Terri.
Thank you, Hallie. And I don't know about the rest of you all who are listening, but whenever I hear Natasha and Chip speak, I feel safer. So with that in mind, we'll talk about some of the return to campus planning. So we have met with almost all of the vice chancellors and talked to them about the planning for the phased return for employees back onto campus, acknowledging that we do have a number of staff who have been on campus holding things down over the last 14 and a half, 15 months while we've been working through this pandemic. Each of the vice chancellors will be sending a communication within the next couple weeks that will give people information about their sort of next time frame of planning, whether it's we're looking to have you come back in this hybrid form by some date in June, or if you can expect to not have to make any changes to your current work strategy before a certain date, whether that be a date in July, August, or that September 1st date that we're all working towards. If you haven't heard anything, it's very likely that you're not coming back to campus on June 1st, so please don't be panicking. I know it's May 18th. I know everyone's chomping at the bit, but we are working as fast as we can behind the scenes to make sure that all things are being planned appropriately with that lens of equity, safety, and innovation that the Chancellor referenced. Some of you may have seen the communications about updates to density requirements for researchers, and it no longer referring to a percentage base. We bring that up to share that did not change things to become a free-for-all. It's just that now the planning is mostly around being able to appropriately physically distance while people are wearing masks and still taking care to engage in the other protections that we have been doing to keep ourselves safe thus far. So while it may not be a 50% or something like that, it will be based on the research space where the research is being conducted. So if you have any concerns, please reach out for the contacts on return to research, and we can support getting any concerns addressed. We're very excited to announce that the Return to Campus Support Desk is live. So for all of your return to campus questions, some of them which I'm seeing in the Q&A today, you can submit those questions to the Return to Campus Support Desk, and they can help to answer your questions and help address any concerns that you have. You can reach them at hr@ucsd.edu. Yes, it's that simple, hr@ucsd.edu. Send your questions. They'll be available Monday through Friday from 8 a.m. to 4 p.m. to get your questions answered. And last, but certainly not least, we announced some training at our last town hall, and I just wanted to talk more specifically about that. The dates that we have right now are scheduled through early July, but more dates will be added as we transition to a blended delivery model for everyone. So don't panic if you went to register and you can't get in and you're like, it's full, I don't understand. Why would they limit it to 300 people if it's Zoom? And that's because we want it to be a meaningful training experience for everybody. So don't fret, there will be more dates to come, but get to any date that you have availability so that you can have all of these tools in your tool belt if you're a manager or supervisor as you're planning to go forward. And just note, for our building inclusive teams and trust and managing remote and hybrid teams, that's for managers and supervisors. The communication and collaboration tools for teams, that's for everyone to sign up. And we will have an inclusive teams and trust session for our regular individual contributors and staff to register for in the coming months. So stay tuned for information on that. And so with that, I will invite my partner on so many things on screen, Ted Johnson, our Associate Controller of Integrated Supply Chain and Chief Procurement Officer, to bring you some updates.
Thanks, Terry. So I'm just going to share a little perspective with all of you from someone who's had many of my units on site throughout the pandemic. And certainly it's not just limited to my units in IPPS or SFS, but from facilities management, housing and dining, the police department, EOC, many people have been on campus supporting operations, as well as our students living on campus throughout the pandemic. And just reflecting back a bit, the initial weeks of the pandemic were very confusing. They were scary at times because we really didn't have a script. We had practiced certain scenarios, but we didn't have a script. And so we knew the basics about, masking and washing our hands and social distancing. But in reality, particularly during those initial weeks, we had a short supply of hand sanitizer, for example. So in my operations, we could not have a bottle of hand sanitizer at every workstation. And for, team members in logistics who were, paired up in a truck each day, it was really difficult to social distance within the confines of a truck. But we got through that, and we got through that with great support, from people like Dr. Schooley, Dr. Sosha, Dr. Martin, who not only served as guides, but served as advocates. And I just really want to express appreciation for that. And so, the logistics team, and I'm going to focus on this a little bit and show you some slides, they had to completely pivot. So the volume of deliveries was down, but at the same time, we were given the opportunity through our partners running the Return to Learn team to really participate in that. So we had to incorporate all these new norms into a new way of doing things. And so if you look at these slides, I mean, we're showing the operation with people masked up and social distancing. And even if you look at the top middle slide, that's a team meeting where everyone's standing in the warehouse and conducting a meeting. I mean, it was awkward, it was different, but it really worked. And now we're quite used to that after a year. And I'm mentioning that because, you know, I know many of us are understandably a little bit apprehensive to come back to the campus, but my main message is there have been people on the campus throughout the pandemic. We've kind of figured it out. So you're not coming back to something that's brand new, you're coming back to something that has a track record. And again, flexibility is key. And I can give you examples even from my personal experience. I mean, when the first 3 months of the pandemic, I hopped in an elevator on campus, and then all of a sudden someone else hopped in and we stared at each other awkwardly. And then we looked at that sign right outside the elevator that said only one person per elevator, and we didn't know what to do. Those situations are going to happen. Masking is very similar. You know, I often see people, or occasionally see people who aren't wearing a mask. It's not because they don't want to, but it's not intuitive to get up from your office and put on a mask when you go to the restroom, you know, and so things like that are a learning curve. But my main message is that, you know, we're not starting from scratch. We have amazing resources, as you've seen, and the campus is a very safe place to be. Thank you.
Thank you very much, Ted. See, we've got a couple more pictures here of your operations over the past year. So it's great to get an update on kind of how things looked for you and your team. So thank you so much for sharing that. So our next presenter that I'd like to welcome to the screen is our Vice Chancellor for Resource Management and Planning, Gary Matthews. So Gary, take it away.
Good afternoon, Haley. Thank you. Welcome, everybody. I thought it would be great to talk about the successes, and certainly Dr. Martin, as well as Ted, have indicated that it's been a team effort, and hundreds of folks have been on campus throughout the pandemic to ensure our ongoing safety. So one of the things that I certainly want to talk today about is the campus cleaning, the ventilation, and the use of the indoor spaces. We will be continuing to clean at much higher levels for sanitation. We've done a lot to ensure that our air exchange and filtration of building systems is the highest level possible for the equipment that we're using. And the cleaning frequencies will continue at the levels that we've managed over the pandemic. What's clear is, as Dr. Martin said, the campus has been relatively safe in terms of transmission, and we're not going to change our focus at this point. If anything, we'll make it as a little more safe as we learn more. We've had a great opportunity to learn from the subject matter experts, and all of that will continue. What will also continue, next slide please, is a greater emphasis on the use of outdoor space. So the dates might be a little off with my pictures, but this is a rendering of a construction project underway for a new amphitheater that has taken quite a bit of collaborative design. And what it does is it really shows that the outdoor spaces of the campus are being enlivened for uses. We have a great environment here in San Diego, and part of our intention is to ensure that we maximize the use of the great outdoors. So the amphitheater project is one. We have quite a few outdoor classrooms, as you've seen from the lead-in intro pictures, and those structures will stay through the fall for classes, and we're talking now with a number of folks across the campus to see what we do longer term with those structures, and maybe they'll stay for student activities and study. We're not sure at this point, but we know that we're starting to embrace the public realm. Next slide, please. This is another building that's adjacent to the area that was just depicted. And what you will see as you return to campus is there will be a number of construction sites, as well as buildings and new facilities that are opening. So in concert with our focus on the public realm. There's been a major project for Ridge Walk. There will be other projects in Rupertus Lane in the core of the campus. And it's what we're really trying to do is make sure that we, one, keep all the buildings safe through the ventilation that I spoke of, but also to give people venues and opportunities to use the great outdoors and use all the fresh air that's outside rather than worrying about the distancing internal to the buildings. Next slide, please. The focus on the outdoors also takes us to one of my favorite projects. It's been one of those that's taken over a decade to come to fruition, but light rail will be to the campus, hopefully by the completion of fall, maybe November, December. And most importantly, it's going to give us an opportunity to really embrace public transportation. Now, we're aware that a number of folks are kind of concerned about using public transportation, but what's clear is that there are details, just as Dr. Martin showed, nationwide, that public transportation has been exceptionally safe, in part because the operators have managed to sanitize and really focus on the cleanliness of those vehicles. So we've done that with our vehicles on the campus. We're working closely with Metropolitan Transit and North County Transit to ensure that they too are managing their facilities and services appropriately. And we're excited about light rail because it gives us an opportunity, one, to provide access to the campus for many that might not have been able to drive here, or most importantly, it will certainly give folks an opportunity on the campus, our students, to go elsewhere throughout the community. It would be one seat from the border up to campus, which is a remarkable accomplishment. I think that we will continue to grow as a campus with certainly the use of public transportation. So as you return to campus, you will see additional construction. You will also see some areas where, for instance, Voight on the East Campus has been finished in terms of its paving and striping. Light rail structure is up. They're going to start testing in the next several months. So many of you who have been on the campus will see tremendous change in the look and feel and even the wayfinding on campus. Our goal is to make the campus less auto-centric and more micro-mobility centric with bike paths, which we've installed on Gilman. We've got a new bridge, the Gilman Bridge, as well as a pedestrian bridge connecting to Mesa Apartments. And we've already noted an increase in bicycle traffic, and that's what our focus is. So it's a newfound embrace of the outdoors. Thank you, and I look forward to working with all of you as we return.
All right, thanks a bunch, Gary. It's exciting to see some things that are kind of coming around the bend on campus. And so for another update about something that's coming up, I'd like to welcome our next and our final presenter before we move into our Q&A, and that's Jill Townsend, Executive Director of Special Events and Protocol. Jill's going to talk to us about commencement and other event-related things. So take it away, Jill.
Hi, Hallie. Thank you so much. Thank you all for being here and getting the most up-to-date information we have. It was exciting when I was asked to participate because this baby right here, the Commencement 2021, has been something that I've been working on with a great team for many, many months now, trying to make sure that our students who are graduating have the very best experience possible. So on June 12th and 13th, we are going to have 10 different commencement ceremonies. It's going to be for undergraduate and for some graduate division, Rady School, and GPS. And our keynote address you'll see here is going to be Alicia Garza, who is an alum and co-founder of the Black Lives Matter movement. So this is the schedule. We have nearly 6,000 students who will be participating with us in person over these 2 days to be honored and recognized for their great achievements here at the university. So we go roughly 4 hours apart between each of these ceremonies. Each of the ceremonies is going to be roughly 2 hours long and will be as close to a traditional commencement ceremony as we can possibly make happen. So you'll see that these end up being pretty long days, but again, very, very excited to offer this opportunity to our graduates. Final day to register, if you know anyone is that should be registering, is tomorrow, May 19th. Undergraduate participation is at about 80% of a typical commencement year. So I think that that's pretty darn good. I think our graduates are as excited as I am about this, probably more. Our graduates who attend with us in person will have the opportunity to cross the stage. And that's something that was really significant to them. And we're really excited to be able to offer that. And we have a way to do that safely. And then for those graduates who will be participating with us remotely and are not able to make it back to site, they will have provided us a slide, and we will, a photo, and we'll make that into a slide for them and integrate that into the stage crossing portion of the ceremony. So it'll be kind of typical ceremonial elements with speakers and with the acknowledgement of the stage crossing, with the tassel turn, etc. The one thing we won't be able to do is a procession, and I'll get more into that in just a minute. But the rest of it will be pretty much like usual. So exciting day. For guests, we were able to work with Return to Learn and campus leadership and provide an opportunity for our graduates to bring 2 guests each. The graduates and guests must enter as a group, so they must come together without exception. And then the graduates and their guests are actually going to be seated together in groups of up to 3 people. So it'll be like their own little mini graduate pod for them. Health requirements, really important. We really wanted to do this, but we wanted to do it well, and we wanted to do it smart. So the hurdles that we'll need to go through are not anything out of the ordinary that we've come to be accustomed to this last year. Graduates are going to use their daily screener to get their green thumbs up. Guests will have to complete a verbal version of that screener at the door. I say door, it's gates. This is all outside. And graduates and guests must have been vaccinated or have a negative COVID test within 72 hours of the ceremony. There will be continuous masking for the ceremonies. While they are outdoors, they're considered large-scale events, which still has a masking component, state, county, CDC recommendations. And then social distancing in line and during the ceremony. As I mentioned, as these groups come in, we will escort them directly by pod to their seats, so there will not be a procession. They'll go through the ceremony. We'll get folks out of their seats, the graduates, to do the stage crossing, and then we will recess everyone together. So graduates and their guests will recess out of the ceremony as the groups that they came in with. Some other ways that we're celebrating our graduates are with the yearbook, and there's some links in the chat for you as well to check these things out if you're interested. All graduating students can have a digital yearbook page. Imagine it kind of like a Facebook specifically for grads. And so it's a great way for them to connect with one another, direct their friends and families to their page where the friends and family can leave direct messages to the grad as a way of celebrating them. If you're interested and want to watch these ceremonies, one or more for yourself, all of that's going to be available on commencement.ucsd.edu. or on yearbook.ucsd.edu. And if you happen to miss it and want to go back and catch one, they're going to be available for replay about an hour after the ceremony, that particular ceremony ends. And last but not least, all of this takes a small army of people to make happen. So we are looking for a number of volunteers, actually somewhere in the few hundreds of shifts are available. The shifts are roughly 3 hours each. You'll get a shirt, sunglasses, and of course, a lot of satisfaction for helping our graduates experience one of the most fantastic and memorable days of their lives. So in the chat, there should be a link to our volunteer form. You can also go to commencement.ucsd.edu and scroll down to the bottom of that front page, and there's a form there where you can select what times you might have available. I do hope that you'll consider coming out and joining us. It's going to be a very memorable, very busy couple of days, but I think it's one that'll make everyone feel good. And Hallie, that's all I've got.
Thanks a bunch, Jill. It's exciting to see that commencement, some elements like crossing the stage and some of those quintessential elements that our graduates, I know, really special for them. It's great that you're able to incorporate that, plus the photo option. So Great
Yes,
creativity there. Awesome. So before we jump into the next portion of our event, which is our Q&A, I want to put a plug for just a couple things. First, I want to let you know that the Staff Association is currently accepting nominations for 4 key positions on their board. Nominations are due a week from today, May 25th. So if you're interested in stepping into or putting yourself up for a leadership position in the Staff Association, this is a great opportunity. So there's a link in the chat where you can learn about that and learn what that nomination process is. I also wanted to share with you that our Faculty and Staff Assistance Program, which is a unit of human resources, has a new group, a new support group called Transitioning the Workplace. It's a weekly support group, really just thinking about this big transition that is happening for many of us, going from maybe remote work to hybrid work, on-site work. So that is every Tuesday at 11 a.m. It begins 1 week from today, Tuesday, May 25th. And I believe there's also going to be a link to that in the chat. The information is also available on Blink. So with that, I'd like to invite all our panelists back on camera, and we're going to move into our Q&A portion, and we'll be answering questions until about 2:45 if you're able to stay with us. So let's go ahead and get started. So Terri, let's start with you. One of our attendees would like to know, will there be merit increases for the next fiscal year?
Oh, I don't know if this will be disappointing news, but there will not be merit increases. Instead, there will be a general 3% increase for most employees. We will be sending out those guidelines to department managers, et cetera, in the next couple of weeks. And we expect a campus notice to that effect in the next couple of days, but there will be a 3% general increase. So there is money coming.
All right, great to hear. Okay, so Natasha, I'm going to send this question to you. This person asks, what is the backup plan in case there is a significant surge in cases when we are mostly on site in the fall with students?
That's a great question. We are going to leverage and work off of the proven playbook that we've developed and executed this year that has been so successful in keeping our campus safe so far. We plan to continually and vigilantly monitor the situation daily through our individual testing program, as we mentioned, our wastewater monitoring program. I also mentioned that we'll also be sequencing the positive virus samples that we get both through our individual tests and the wastewater. That will allow us to monitor the prevalence and any potential expansion of variants of concern on campus. And so, like we've been doing this year, monitoring the situation daily through our COVID monitoring team, we'll be continuing to monitor through all of these systems that we've developed. And again, generally, following this playbook that we've developed in terms of risk mitigation, viral monitoring, and prevention to adapt and continually assess the situation if the circumstances change.
Right, thank you. Okay, next question, and I'm thinking, let's see, let me read the question. What is the campus mask mandate now that the CDC has lifted their requirements for vaccinated individuals? So I think this kind of has 2 aspects. So let's start with Terri to kind of tell us, what does this mean for UC San Diego from that front? Then I'm wondering, maybe Angela, tell us in terms of masks and, why are they important? And so more the medical side of that. So let's start with Terri.
So while the CDC has changed their guidance, nothing has changed for the state of California, for the county of San Diego, or from Cal OSHA, which regulates us as a workplace. So nothing has changed as it relates to mask requirements. Now, as it relates to certain events or things like that, our campus guidance is following the county guidance, and we try to keep that updated as quickly as possible and to nudge the county to update when they need to get on board with other changes. But nothing has changed as it relates to that CDC change last week, because we are still governed by the state of California and Cal OSHA. But Angela, I would love for you to also add your thoughts to that.
Yeah, thanks, Terri. And I think, we've done a really good job by actually doing a little more than was required in many other places, both in the county as well as the state. And I think that's been our philosophy as well as we go through these last few weeks of spring quarter. So we want folks inside, unless you're in a private office, to be masked. Indoor dining only for those that are fully vaccinated. If you're not fully vaccinated, then we recommend that you eat outside, because you obviously have to take down your mask. For outdoor activities, most of these can be done outside fairly safely, and except for when it's crowded situations, such as commencement, or sitting close together at large numbers if we have sporting events, et cetera. So we're trying to pretty much keep things in place. Our students that are residential students are staying in phase 2, which means that they are not able to visit between units, but they actually are able, that's one place we do let them take off their masks because they've been very good with the testing, et cetera, but they're not moving between units. If they want to visit with other students, then we recommend they do that outside in other venues. So pretty much kind of stable for the next few weeks. Let's just try and finish this up. That'll give some time for the state to respond to the CDC guidelines, the county to respond, and for all that to come into a little closer alignment. Because as Terry mentioned, while CDC has made these recommendations, our state is not at that same spot. So we're trying to take the best of everything and keep us as safe as possible.
Awesome, thank you both. And I'll just remind everyone the best way to learn about these things, read your campus notices, attend events like this, and we'll update you when our local kind of campus policies change and tell you what you need to know. All right, so next question, I'll send this to you, Ted. So people are thinking about coming back to campus. So this person asks, so as I'm thinking about returning to campus, do I need to bring my own PPE? Is that something that staff need to bring from home?
I think fortunately the supply chains have stabilized for PPE. And so we don't really have any supply constraints like we had at the beginning of the pandemic. So, you know, I know we've already provided some masks to staff. I'm assuming that many staff are going to have their own PPE, but what I can say is there is no shortage in terms of what we have available at the campus. That includes sanitizer, gowns, masks, and things like that.
That's great to hear. We're back on track with all of that. All right. So Chip, let's send this question to you. This is a vaccine question. Is there any new research on whether fully vaccinated individuals can shed the virus? And maybe a follow-up to that, what's the exposure risk for children, including infants and toddlers, from vaccinated individuals?
Some people who are vaccinated can become infected and shed virus at low levels for a short period of time. There are more and more studies that have looked at shedding after vaccination. We published one here in the New England Journal of Medicine from the UC San Diego health perspective. The data suggests that the levels of shedding are very low and difficult to be close to what we think is necessary to be transmissible under most circumstances. Now, it doesn't mean it can never happen. It just means it's very unlikely. In normal conditions, we think that about 80% of the infected cases come from 20% of the people who have the most virus, the so-called super spreaders. And with people who've been vaccinated, you don't have these super spreaders. You have a few people shedding a little bit of virus, so that that's one of the reasons why the number of new cases has dropped so rapidly, is that the vaccinated people aren't passing it on. It is possible that people who are vaccinated could shed virus, as happened, for example, with the New York Yankees not too long ago. In that episode, 8 of the 9 had no symptoms at all, and they were only found to be shedding virus because they were being tested twice a week. And on the positive side of that, what may well turn out to be happening in the human population is those short bouts of a little bit of shedding may be what serves as kind of a natural booster shot and keeps our immune system up. So we may not need to kind of keep reboosting. That's what happens with the older coronaviruses that have been in the human population for 800 or 1,000 years. We'll have to see about this over time. For people, though, who are kind of living with people who are immunocompromised, they may want to go ahead and continue to protect themselves when they're in high-risk situations, just so as not to put their family members at risk. We're in a situation, I think, where we're not going to have a sudden beach mask burning. We're going to have people gradually remove their masks as they feel safe and as more and more people get vaccinated. But there will be some who will continue to wear their masks because they're immunocompromised, some because they have people at home who are at risk, some who don't want to get the flu. We may well have a bad flu season coming up this year because we didn't have one last year. So I would certainly encourage people to think about flu vaccination. But the short answer is yes, occasionally people can shed it, but the amount of shedding is so much lower that it's not in the same range that we saw in unvaccinated people.
Cool, thanks, Chip. It's a good reminder also that people may have different reasons for continuing to wear a mask, even maybe as rules change. So I think that's a really good reminder to share as well. Okay, so our next question here is related to events. So Jill, this one's going to come your way. Can you use your crystal ball and tell us whether you think we'll be able to host a 50 to 100 person event off camp, or a 50 to 100 person event off campus in spring of 2022? So this one's a little like far in the future. So maybe you can't tell us about spring 2022, but what can you tell us about in-person events and folks who are starting to think about the coming year in terms of their events?
Yeah, actually, I was happy for this to be a question out in 2022 because I think the hope is things will have settled down a bit by then. So, you know, my crystal ball being what it is right now, a little murky, I think that one, yes, you know, we're probably very likely to be able to have those 50 to 100% events off campus in, 9 months. In the shorter term, I know that and Natasha, I think, spoke to this a little bit. The campus has been very conservative, right? This has kind of been a trend across this conversation, right? We've made really careful decisions along the way, supported by science. And I know that the campus will continue to do that. What that means in terms of events is probably a slow stepping in and rather than a head first dive into events as we move forward. So things that support campus operations directly and imperatively, right? The student experience and those types of things I think will be prioritized. But I expect that as we move forward, there will be a slow opening and the campus continues to step in line with what's happening for state, local, and CDC guidelines. And so as those things open, I expect that we'll open too.
Cool. So kind of gradual process, just like we're looking at everything else. Very good.
Oh, absolutely.
All right. So Gary, this attendee would like to know, is there a way to check whether our building's HVAC systems have been upgraded?
Yes, there are several links online through management that lists buildings that have been upgraded, and those that aren't on that list have not been upgraded to the same level, but all buildings have been assessed for their airflow and the volume. And there's some questions in the chat about Torrey Pines Center North and South, and up until maybe a month or so ago, those buildings were contracted out for service, and facilities management is now managing them. So there'd be a change in that list to reflect that those buildings as well will be assessed.
Cool, thank you. And I'll just remind you, if for those of you who may not be checking it out, there's lots of questions being answered in that Q&A box. So if you haven't checked it out, click it. You can look at the answered questions, view the answers. So that's just a handy way. You may have a question that you didn't even know to ask that is answered there too. So we've got 2 streams of questions going on here. Okay, so we had quite a few questions come in about our REMAC Vaccination Center and also vaccines for 12 to 15-year-olds. So Angela, kind of being our on-campus vaccine person, I'd like to send this one your way. So this question says, are vaccine walk-ups available to family members of staff and faculty at REMAC? And can I bring my child who is 12 or older to REMAC for walk-up vaccination? And this would also apply to Price Center following the closure of the REMAC Center.
So yes, on REMAC is available for walk-ups to family members, and I believe they are also now able to give the younger individuals the vaccine, the 12 to 15. I will double check that and put it in the chat, but I think it should be able since they got the approval. The second part is when REMAC closes, that'll be on June the 1st. We will switch to Price Center, as the Chancellor mentioned. Price Center will not be open to the public. It will only be for campus employees, staff, faculty, and students, including incoming students, and it will be by appointment. So there's a difference there. But we'll also be putting in place, if you go over to the REMAC and you get your first dose now, you'll be given an option to get your second dose at the Price Center. So they are working on, they'll also create other health system locations for your second dose. So if your family member goes with you to get vaccinated, they may not be able to come to the Price Center, but they'll be given other locations in the health system to get their second doses. So I would not at all hesitate to get first doses now, between now and the Price Center being closed. We should be in very good shape. I don't know if Chip, you want to comment any more about the younger age vaccines and when we think we're going to see something even below the age of 12.
Well, studies are ongoing now. The at some of the lower age levels, around 2 and 3 and 4, they'll have to give lower doses of the vaccine. Up until down to 12, the same doses of vaccine are being given that you give to adults, because 12-year-olds are basically adults who behave better but are almost as big. And when you start getting down to 2, you have to scale down the dose, and they'll have to do some studies to see how much lower the dose needs to be in that age level. Having said that, I imagine that they'll have most of that figured out by the end of the summer, and we'll be seeing lower and lower age bands have access to the vaccines as the summer rolls on.
Okay, thank you. All right, so next question, whichever one of our health experts might like to take this. Can you discuss the safety of air travel right now?
You know, vaccinated people, I think, can travel on a plane very safely. Airplanes are highly ventilated. They're highly, air is highly filtered, and the air in the planes is really quite safe. The issue you run into is you're sitting very close to other people, and at least on every airline I've been on forever. And the people who are sitting next to you are the ones who are going to put you at risk. For vaccinated people, all of us will be wearing masks on planes. For vaccinated people, I see the risk of air travel as being extremely low. I'm going to take an airline trip on Sunday, and I wouldn't have done that before I was vaccinated, unless I really had to. For unvaccinated people, I think you should still think hard about whether you want to get on a plane, and should really consider getting vaccinated if you're going to travel on an airplane or a bus or other public conveyance. I know that the Government Accounting Office is looking at airline safety and whether or not even vaccine mandates will come about for people who want to fly. Some airlines are talking about that already. Qantas has talked about that. So this may be one of the things that will separate vaccinated from unvaccinated people over time.
Thank you, Chip.
And I just got confirmation that REMAC is vaccinating 12 to 15-year-olds. So bring your children on over and get them vaccinated.
All right, thank you for checking in on that live on the spot, Angela. That's great. All right, so this next question came in through the Q&A today through one of our attendees. And Terry, I'm going to send this question your way. What is the status of the proposed UCOP, so that's UC Office of the President, policy to mandate vaccination? And are we going to be relying on the honor system for vaccination status?
That's a good question. And as people probably see from the Q&A, it's a number of people's question. So right now, OP is reviewing the comments that they've been receiving over the last month, and they're accepting comments and questions on that email address that you can find through the RTL pages on the vaccine page through the end of this month. The expectation is whatever policy they roll out will be rolled out for September 1st, and it will be related to FDA approved vaccines. What we don't know is exactly how they're going to have us enforce the policy, or if it will be handled like we did on our campus for the flu vaccine mandate, where there'll be an attestation and something. So stay tuned. As soon as we have more information, we will share it out with you all so you know what the expectations are. But in the meantime, if you can get vaccinated, please do so. Please do it for your loved ones, for the folks who don't have the ability to have the vaccine effective because of immunocompromised issues. Do it for the small kids like mine who can't get vaccinated yet, but want to go and experience more of the world. Please get vaccinated. So that's what I have to say on that. Thanks, Hallie.
Appreciate that, Terry. Always a good message to emphasize. So we got a couple questions about parking. So Gary, I'll send this question your way. Will there be more parking permit options now that many will be only coming to campus a few days a week?
Yes, in fact, if folks, and I don't have the site memorized, but if they go to the Transportation Services website, there are a variety of new options for folks to basically pay for what they use. So the notion that you have to buy a monthly pass has changed significantly over the last several months.
Okay, so just kind of new options available kind of based on how often you're coming to campus, and to check the website for that information is what I'm hearing. Very good. Oh, and I see that Josh Kavanaugh has plugged the link to the chat here. So great. So click the link in the chat and you can learn more about that. So here's another question that's come up several times, that's come up in our Q&A today that Chip answered in the Q&A that we think would be good to kind of answer on camera here. So can the COVID vaccine affect fertility?
There's really no evidence that it affects fertility. That's been a rumor that has been floating around for several months. I have no idea where that started. And people have looked and just haven't seen any evidence of it, and people have been vaccinated. The other thing that's important to know is that people who are pregnant and get infected are more likely to have more severe disease than people who are not pregnant. So if you're contemplating getting pregnant, I would certainly recommend that you get vaccinated. Talk to your obstetrician about it. In the formal trials, pregnant women were not included. That's tradition for when new drugs or vaccines are brought out. But since the trials have been completed, there has been a large experience of vaccinating pregnant women, and there's no evidence that the vaccines cause any more problems in pregnant women than women who are not pregnant. And again, because pregnant women can get into trouble if they get infected, certainly talk to your obstetrician about getting vaccinated if you're pregnant and haven't yet been vaccinated.
Okay, so Terry, we've got some questions coming in both before and during related to basically how are decisions being made. So here's kind of a couple pulled together and maybe you can offer some insight. So will each vice chancellor decide for their area if staff will be allowed to work a hybrid schedule? And how is equity in return to learn being handled across different departments?
So these are really great questions. I'm glad that somebody asked them so we get to talk about them. So the vice chancellors are setting the overarching guiding principles that fall within the campus framework. And then they're identifying VC project teams. So we have a project lead, we have the person who works on the communications and HR support to make sure all the work is being done. As it relates to equity, equity in its barest form is about fairness. It's not about everyone having the exact same thing. So people, please do not worry about what your next cubicle colleague has. Make sure that the work arrangement that you have is the right work arrangement for you and the work that you do. Equity is really about making sure that there's fairness in the process in determining, based on operational needs, what can we afford as far as flexibility in the work that we're providing. There are a lot of front-facing workers that can't have hybrid work schedules. They've been the ones for, in large part, holding our campus down for the last 15 months, right? So for them, flexibility might just mean a change in work schedule, different core hours, some other form of flexibility in that way. For our folks who have been hybrid or remote during this whole time, that may mean some adjustment of hybrid, some more in-person for remote workers, giving them the options of flexibility in their scheduling, et cetera. But the key is fairness and transparency in how the decisions were being made. We chose your position to have the option to work hybrid, offsite for up to 3 days per week, because for 2 days per week, we need this amount of coverage in this kind of way, right? So if that information is given, it breeds the transparency that will allow the employee to have the psychological safety to say to their manager, I have these concerns and cannot meet those needs right now, but I can as of X date. And then we can have more conversations around that. So that's what we're trying to establish, a place where people can bring their whole selves to work and talk through the different challenges that are facing them so that we can all be our most effective and efficient selves.
Love that. Related question, can information be shared regarding how other departments are returning and what the campus density looks like? So how might somebody learn kind of what other departments are doing in terms of returning to campus?
That's another great question. So Hallie, you know this, but for everybody else out there, as part of the overarching planning around communications related to the return to campus, in our upcoming town halls and on the Return to Learn websites, we'll be showing some images like the ones that Ted showed earlier of folks working on campus or returning to campus, what it looks like, some success stories, how people are adjusting. It will be an adjustment for those folks who've been here the whole time, right? Like now we've got all these people in their space. And then for the folks who haven't been on campus the entire time, getting to know the campus again. So we're gonna share some stories so people can have some faces of what's changing all around us.
All right, Terri, while I've got your ear, one more question. What are the results of the staff survey return to work? So that survey that closed on the 14th last week, when will folks find out about those survey results?
So OSI said that they're going to be able to give us some of the final numbers at the end of this month. That information is going directly into the planning with each of the VC teams on the return to campus, because all of the managers want to know. All of the senior leaders want to know. And frankly, I know all of you employees want to know as well. What are our colleagues saying about what they want? What we saw in preliminary results is people miss each other. They really do want to see each other to some extent. I'm one of those people. Now, That means that people want to have hybrid options for the most part, if their work lends to it. But there are a lot of people who are very self-aware that their work requires them to be in person their entire time for working because it's the way that their work is done. And so it's really refreshing that we have our self-awareness folks and that people miss each other so that we can all like have that vibrancy once again very soon.
All right, thank you very much. So looking at my clock here, we've got just a couple more minutes. So I'd like to just open it up to our panelists in case there's any kind of final thoughts or maybe anything we didn't cover. So any final thoughts before we wrap up, panelists?
I think one thought is that if we think back where we were a year ago, we were having very different conversations. We were thinking about getting out of the campus as fast as we could and how we could maintain whatever momentum we had in terms of our educational and research missions. We're now in a much better situation of coming back to campus. And in some ways you can argue it's more complicated to come back than just to go away. But the kinds of I think creativity and resilience and cohesiveness we have seen among all of us over the last year, I think, is going to make it possible for us to transition back to the kind of campus that we had before this all came our way. And I think everyone should feel good about the way UC San Diego has handled this and all the support we've had from everybody on this call to help us get through this epidemic the way we have. We're looking forward to a new day, and it's really great to be in the situation in 2021 that's very different from where we were in 2020 at this time.
I like those reflections, Chip. It's good to look back kind of at the fullness of time and reflect on our experience and look ahead and think of all the exciting things we have coming in the pipe for us. Well, with that, if there are no more final thoughts, then we'll wrap up for today. And so you'll receive a survey for attending today, and we encourage you to fill that out. It helps us understand what you want from these events and what you're looking for so we can recalibrate and make sure that they're serving you well. We'll share the date for the June town hall shortly when we get that nailed down. You can find that on the Return to Learn website in the coming weeks. We didn't get to all the questions today, although we did get to quite a lot of them between the Q&A and in person. So we'll post some of those questions to the kind of the ongoing Q&A that's on the Return to Learn website. You'll see a link to that in the chat that just got posted. So with that, thank you very much to all of our presenters, whether you've been with us every time or if this is your first time with our staff town hall. We're so grateful to have you here sharing your expertise and your information. And I look forward to seeing everybody next month.